Hi, this is Dr. Desmond White. Today I want to talk about what happened when you have liver cirrhosis and you had to undergo a surgery. So I was recently referred a patient that had to undergo a surgery on some of his bones, and he had liver cirrhosis in the past. So what do we do? Well, when a patient has liver cirrhosis and need to undergo a surgery, we need to know a few things. First, what's the cause of the liver cirrhosis? If they have hepatitis B and C, we generally would recommend that they continue with the medication. And we also need to know how bad the cirrhosis is. So we grade cirrhosis according to how severe they are. We call it the Child-Pugh score and the child's classification. We grade them into A, B, and C. A is the best, C is the worst. So if someone having a Hep C, child C, liver cirrhosis, after a surgery, they may have some complication. So if we look at the stage of the cirrhosis, we also look at the kind of operation they do. We are concerned if the surgery involves a lot of blood pressure change, such as the open heart surgery, abdominal bleeding. Then when the blood pressure fluctuates, when there's a loss of blood volume, the risk for surgery is higher. If it's a surgery for the limbs, or for the say cataract, a smaller surgery for the hand, for the hip, for the leg, they're not so bad. So we look at the type of the surgery. Then what happened is that if the patient have a child C cirrhosis, they are quite sick, they are jaundice, they have cirrhosis, they have ascites, they have water in the leg, water in the abdomen, and if they undergo a major surgery, there's actually a risk to the surgery. The risk can be quite high. So for those patients, we will want them to see an anesthetist, to see a hepatologist, optimize them, warn patient of the complications, and they should really undergo surgery unless they really have to. On the other hand, if they have child A cirrhosis, a very mild cirrhosis, they go for most of the surgery, they're usually fine. So the reason why a liver patient get worse during surgery is this. First, liver cirrhosis means the liver is hardened. If there's a reduced oxygen supply or reduced blood supply to the liver during the operation, say during anesthesia, due to blood loss, due to the operation, due to medication, the blood pressure drop, oxygen drop, and the sudden reduced oxygen supply to the cirrhotic liver may lead to more liver damage. So some liver get worse after that. Also, medication to put people to sleep, they are either metabolized by the liver or the kidney. So if the drug is metabolized by the kidney and it's metabolized by the liver, and the liver is sick, then the drug may not be fully metabolized or broken down, and the effect of the drug may hang up a bit higher, and they may cause complications. So they may need to dose adjust according to the manufacturer guideline for the medication. The third is that people with liver cirrhosis, they may have what we call portal hypertension. There may be cholesterol, blood vessel, abnormal blood flow in the abdomen. If they do an operation in the abdomen, the surgeon may encounter unusual bleeding. The fourth is that people with cirrhosis may have a low platelet count and a prolonged bleeding time, and that's because the liver make clotting protein to help the bleeding time. The liver also make a hormone called thrombopoietin to help our body make more platelet. When the liver is sick, it makes less platelet, less thrombopoietin, and less clotting factor. So in people with liver cirrhosis, they may encounter more bleeding complications during the surgery. So by and large, if you have cirrhosis and you need to undergo surgery, do check to make sure that you do need the surgery. The surgery is not something that you can choose, something that you must have, okay? And look out for the medication to put you to sleep. Look out for any bleeding complications. Talk to the anesthetist. Make sure the blood pressure and oxygenation are maintained at a good level. Have an imaging study of the abdomen to make sure that there are no abnormal shunting blood vessel in the abdomen that will lead to unusual bleeding when they open up the abdomen. And monitor the liver function 2-3 days after the operation. Consult a hepatologist if someone with cirrhosis needs to go for a major surgery. I hope I explained all this. To sum up, most of my patients with liver problem can actually undergo a surgery safely. We just have to look out for the complication, watch out for the complication before, during, and after the surgery, especially bleeding, and especially change in liver function, and most of the time they will be fine. Thank you.